Hello, my name is Elaine Sanchez, founder of Caregiver Help, and I am back with Tim Rocak, and we are talking about supporting families and family members with developmental disabilities. And we've had some really great conversations so far. And in case you've missed it, you can go back and watch our recordings about infant and early childhood and how to find help and resources for children if you think there may be something wrong with your baby. And then we talked about getting ready for school, preschool, and for school. We talked about the public school system and what this can be like, the help that you can expect and ask for. And now we're going to be talking about the sources of support that would be available for your child and hopefully for you as well. So, Tim, welcome back. And I'm so happy that we can have this conversation. We talk about, when we talk about caregiving, we talk about the importance of self-care, of taking care of yourself. And it's the same theory. It's different if you're taking care of an aging parent or of a spouse, because you know that there's going to be an end point to this. And you know it probably isn't going to be forever. It's different when you have a child with a developmental disability. And I think self-care is critically important. And I think it may be a little bit harder to find sources of support and to find the ability to pay for it. So that's this is another tough conversation, and I would really like your input on what kind of sources are available to help the parents of a child with a developmental disability.
Elaine, I'm going to answer that as best I can, but before I go there, I think it's helpful to know you're not alone.
Yes.
And there are 7.5 million kids in America enrolled in special education. 7.5 million.
Mhm.
And there are 14.5 million children who, that's 1 in 5 in America, who have special health care needs. So there are lots of families affected by disability in their children.
Mhm.
The good news is that because of that, there's been improvement in how our society addresses the needs and the rights of individuals with disabilities. There's numerous advocates with and without disabilities across the world, not just in the United States, advocating for the rights and services for people with disabilities. And these legal rights have been codified formally in laws. There's the ADA, there's the Individual
Yes.
Education Act,
Mhm.
and there are lots of national and state actions to make things better for people with disabilities, not
Mhm.
just because it's the right thing to do, but because it's a legal responsibility. And then I want to add, because we don't go this way very often, but some examples of change in our society, we see people with disabilities a lot more commonly in our daily lives.
Yes.
At one point in our society, America's approach was to hide people with disabilities away, group them together, and pretend we don't have people with disabilities. That's
Mhm.
long gone in our society. We have successful actors, models,
Mhm. Mhm.
entrepreneurs with disabilities. Um, there's a series called The Good Doctor that's on TV these days. The doctor is a young man with autism in the show.
Okay.
And I guess it's just really a happy place to be able to say that we are progressing.
Yes.
There's a lot of things we can do better, but it's nice to see that we've changed how we look at disability in our society, at least to some extent.
Mhm.
In
So
terms of resources,
when you think about what specifically, what kinds of organizations or groups might be helpful to a family?
yeah. Um, There's all kinds of groups. I'm trying to figure out how to best put it for you. There are informal level groups that could be helpful to
Okay.
you.
Mhm.
Some of what I've heard, mothers generally, I don't think there's an exclusion of fathers. I think it's still more common that moms are more likely to be home with their child with
Mhm.
disabilities. But I've heard lots of very positive things from parents about their parents' groups. And those can be as
Mhm.
simple as our community formed a parent group, and it's usually somebody's mom or dad that's been involved in setting that up. And then you hear about it either from your caseworker or from your preschool,
Mhm.
and eventually you start meeting with families for um, emotional support as well as
Mhm.
information, ideas, and ways to help your child. So you can go from the informal level to national or even international organizations. Some of them are formed around particular disabilities because in some
Mhm.
cases, those disabilities have unique needs and information related to that. And some of them are broad, anything from NAMI, National Association
Mhm.
for Mental Illness.
Mhm.
There's the ARC. The ARC was formed by parents of kids with disabilities, often cognitive disabilities. At one time, it was called the Association for Retarded Citizens. In our world today, we treat retarded as the R word.
Right.
And so that has been renamed as the ARC, keeping some of their initial brand identity, but
Mhm.
recognizing that we don't want to spread negative stereotypes calling
Mhm.
people retarded.
Mhm.
The ARC is a national organization that has local chapters, and many communities, I know Oregon has a state ARC, and then there are chapters perhaps by county or by municipality. Um, so there's a multitude of organizations. We will attach in the comments a resource list. Again,
Mhm.
not a comprehensive resource list, but a list that has some of these organizations and where you might find them.
Mhm.
There's a wide range of organizations that could be helpful to you as a parent, and in some cases, even for siblings. One of the
Oh, yeah.
things that
Yeah.
maybe isn't talked about enough is the effect on the family
Mhm.
when you have a child with disabilities. It would be naive to assume that that doesn't affect the brothers and sisters as well as the parents in that family, as well as the individual themselves.
Mhm. That is so true that a child with a developmental disability needs special attention, different attention. I can see that. I hadn't really considered it. Although I did read a book by Jodi Picoult about a child that had a really severe case of autism and how that impacted the brother. That they always had to make accommodations for this kid, and his schedule and his routines and the colors of food that he would eat on certain days and all of that. And that can be very hard. It's hard on the parents, and it would also be hard on a sibling to understand why their needs are seem to always come first. Yeah, I hadn't. That's a thing that brings up another question. Um, as a parent, you get exhausted. You get worn down with this. You're trying to do the best for everyone, and sometimes you just need a break. You want to take a nap. You want to take a day off. Maybe you need to see a counselor. Maybe your marriage is stressed and falling apart. So, are there resources, counseling resources? Are there respite programs for families so that the parents can get a break from this once in a while?
I'm going to be candid. There's not enough.
Yeah.
I don't think I've heard a family yet say, we've got all we need. So I
Mm.
want to be honest about that. But yes, there are services, and it's probably a good time to make the point that self care is caring for your child. If you
Yes.
are not healthy, if your marriage is not healthy, if your relationship with the rest of your family isn't healthy, that's going to leak into your relationship with your child with disabilities. And
Mhm.
sometimes, especially kids with disabilities that don't communicate in traditional ways, they
Mhm.
may be more impacted by that than you're able to discern, simply
Mhm.
because they don't communicate in the same way as somebody else might. It might take the form of a behavioral outburst that you don't understand what it's about.
Mhm.
It may
Mhm.
really be about, I'm concerned about mom. She seems worn out.
Oh yeah. Yeah.
No, it's
Or she's
guilt free.
mad. Yep.
Guilt free. If you can
Yes.
find the resource, you're not just doing it for yourself, you're doing it for your family and you're doing it for your child with disabilities.
So, are there programs that you are aware of, national programs for respite care for parents?
Most
Or,
of the respite care that I'm aware of comes through the county.
okay.
Certainly in Oregon, where we live, that is the way it's done. Now, there may be another disability services entity
Hmm.
that
Hmm.
also has access to those services. In Oregon, I know that there are some funds available to kids who have diagnosed disabilities that are eligible for services. Respite care can include just time away from home with somebody else taking over
Yeah.
the supervision and the support. But it
Yes.
can also include doing something with your other children that you're feeling bad that you're not spending enough time with
Hmm.
because you're spending your time supporting your child that has the most support needs.
Hmm.
So the respite care is often limited, but there are individual respite care providers that can be contracted through your county developmental disabilities program funding.
Okay. Okay.
Um, there are also respite care agencies as well as individual providers. I mentioned the ARC. The ARC
Yes.
is one of the sources of respite care sometimes for families of kids with disabilities. Some organizations have grant programs that you can apply to
Hmm.
for those sort of funds to fund that kind of need.
Hmm. Hmm.
Again, sometimes I think families think that's selfish or it's somehow not meeting their responsibilities.
Right.
You can't meet your responsibilities if you're not healthy. And
That's
so
exactly right.
let's say it again, guilt free.
Guilt
There's
free.
plenty
And
of guilt
self
going
care is
around
not
already.
selfish. Yeah,
Yeah.
that's right. Yeah, and it is, I think it's hard for people, but if you can wrap your head around the idea that you are going to be a better parent if you take care of yourself, you're going to have more patience, you're going to have the physical and emotional and mental strength to do this, and it takes a lot, and it's a long term situation. It really is.
There's
Um,
also, Elaine, there's something that I call backdoor respite care.
okay.
Um, it's not an official term. I don't know that I would be quoted on that, but what I mean by backdoor respite care, there are groups that sometimes have social events. So I know sometimes a group home of people with disabilities um, might have a dance,
Okay.
or the ARC or some other group, bigger group that serves people with disabilities might have some kind of resource fair or an outing to the coast. And
Okay.
those are supervised activities. So I call it backdoor respite care because it's dressed in a meaningful activity for your child that they might enjoy, getting out to see different people and do different things, but you get to take time off.
That's awesome. So, do they have programs that would include a child in school, like in
Sure.
middle school or high school?
Yes,
Well,
all
that
ages.
would be great. Okay.
Mhm.
Yeah.
And that's
So,
a
if
really
you
good point because the supervision requirements of families with people with
could.
significant disabilities, um, don't go away when the child turns 14 or 15 or
Right.
wherever we may, without a child with disabilities, think that our child can be more unsupervised. That's part of why there's so much stress on families, is that
Yes.
that need persists in many cases.
Do you have any advice for families on how they can keep a marriage going? Um,
It's hard. The
it's
divorce rate, we have to acknowledge, is extremely high for parents with a child with disabilities. I've heard it quoted as high as 80%. I haven't
Mhm,
seen data
mhm,
to that quite that high level, but the studies that I've seen exceed 50% in terms of the marriages.
mhm,
So it's a real issue that you have to pay attention to. Um, One resource that I didn't talk about is Social Security. If
mhm,
your child has been determined eligible for Social Security support
mhm.
due to their disability as a child, you may have access to as much as $990 a month. That money can be used for anything that supports the child's needs. And as we just
Mhm.
talked, respite care is an appropriate avenue. You can use that money to support respite care as well. Again, there's a limitation. You may not receive much SSI because you have income. If you have a sufficient income that you don't need SSI, then you're going to be expected to pay more for your own support needs. But many families are use some SSI money. Uh, Sometimes they can hire a paid caregiver for a period of
Mhm,
time
mhm,
themselves.
mhm.
And in Oregon, there is a program that allows the family to hire the caregiver rather than work through an agency.
Oh, that's great. Yeah, that's great. So the it's hard to hold a marriage together, but if you can find some time to be a husband and a wife rather than just parents. And I think this is hard raising normal, healthy children with no disabilities.
You
It's
bet.
it's hard, especially now. You know, if it takes a lot of income to meet a family's needs. And I'm wondering about when both parents work. Um, what where can a child, like a high school child, go if there is a need for after school daycare or after school environment? Are there places?
There are, and some of it depends on how much support need your child has.
Uh-huh,
So
uh-huh.
if your child can handle situations more or less independently with a
Mhm.
fairly minimal amount of supervision. Typical after school programs are available to kids with and without disabilities. You might
Okay.
find them through the local Y or the Boys and Girls Club. I know Boys and Girls Clubs have programs specific for after school programs for kids that are called latchkey kids in some cases.
Okay.
They don't have parents at home immediately. And some of those programs are very good and quick to accommodate supporting kids with disabilities. As your child has more support needs, that may require more supervision and more specialized sort of support that
Mm-hmm.
you can't do when you're supervising 15 kids at once in a gymnasium.
Mm-hmm.
In
Mm-hmm.
those cases, again, sometimes county programs and other funding grant programs allow to support your child, perhaps with a staff person that would come along that you would provide, you hire, or maybe there are more specialized after school programs that focus on disability in particular. Um, Again, the ARC is a organization that I know has done some after school programs for kids. Sometimes parents band together and create their own after school program.
Mm-hmm. Mm-hmm.
I'll get Tuesdays. I know your son and daughter. I can handle
Mm-hmm.
4 kids,
Mm-hmm.
because I know these 4 kids and you know me, and we can teach each other and trust each other. So sometimes parents solve it themselves that way. Solve it. It's not
Yeah,
solved.
right, right. Come up with creative solutions. I think that's awesome. It occurs to me as we're having these conversations that the internet can be a tremendous resource of information. Your school, your social worker, your I think tapping into every resource that is available to you gets exhausting, but it can also provide you with the services you need to help your child have as much of an independent life as possible and to let you have one too.
That's right. There
Yeah.
are a couple other tips I could offer.
Yeah.
One of the traps that is really hard to avoid as a parent is
Mhm.
having to be the one. Even sometimes between two parents,
Mhm.
if I'm the prime caregiver because I'm with the child more, I start to feel that as my responsibility and my role. As much as I feel like I could use a break, the same person in me that needs the break is the same person that won't let
Right.
somebody else take over.
Right.
And I think again, in in order to overcome that, you have to imagine that your child is more capable sometimes than you give them credit
Mhm.
for,
Mhm.
and that mostly they're going to be okay. Somebody else can probably handle it. They may not be as good as you are, but then they might bring something to the table that's different than what the child gets from you. Um,
Yes.
and that's true of all kinds of parenting, but it's true of individuals outside the family. So, is there a grandparent maybe that has familiarity and dedication to
Mhm.
that child's well being that, maybe it's not good for them or good for the child to do a whole day at grandma's
Mhm.
or grandpa's on the
Mhm.
weekend, but maybe an hour, maybe 2 hours, maybe time for you
Mhm.
to get your hair done or go to a counseling appointment
Mhm.
or
Mhm.
your spouse.
Mhm.
Sometimes it's hard to ask a spouse that is burdened with responsibility as well. Um, and then there's siblings as well. It's a delicate balance. It's a tricky line to walk. You
Mhm.
don't want the siblings to have it be their life that they have to take care of their brother or
Yeah.
their sister, but don't deprive them of the opportunity. There are siblings that love doing special outings
Mhm.
with their
Mhm. Mhm.
sister or brother with a disability. We've focused a lot on the challenges and the needs, but there's wonderful things that happen in families with disability. Um, you know, some of the most sensitive, caring, um, enlightened teenagers I've run into have siblings with disabilities.
I bet they are.
And they
Yeah.
become better human beings and more knowledgeable because they become open to differences in how people behave,
Mhm.
being
Mhm.
non-judgmental. And we wouldn't deprive our teen sibling that opportunity if we understood that that really is an opportunity sometimes.
Oh, that's beautiful, Tim. Thank you. That is, this is a difficult topic, and I think it takes a lot of resourcefulness and a lot of research to find all of the resources that might be available. And I like how you keep coming back to finding other parents and being with people who have a similar situation, who understand what it's like. And then you can have that support built with the adults and also with the kids, because then they get to have a social life with people that they can identify with.
That's right. And Elaine, you hit on something that I like to say out loud to families because sometimes you are a little isolated,
Mm-hmm.
especially when you're researching or you're home alone and you're dealing with
Mm-hmm.
a challenge. Um, it's, the entire family is affected. Some of it's good, some of it's bad.
Mm-hmm.
But your child is an entity beyond you.
Yes.
And so you do what you can, but give the individual the opportunity to become their own person.
Mm-hmm.
Some of it'll look like what you thought it was going to look like, and some of it won't. Some of it will be better in many cases. But that individual you're working with them to give them their own agency, as an individual, where across time you will have less responsibility and they'll have more responsibility.
And that's a beautiful thing for everybody.
That's right.
That's right. Okay, Tim, I think that this has been really helpful, and we have a couple more things in the works that we want to talk about. So, what I'm taking away from this is that nothing about this is easy, but
That's
there
right.
can be tremendous joy and growth as you help a child with developmental disabilities become an adult. And I know through the program and all of the fundraisers that we have been to at Garton, that giving them a chance to work, to earn their own money, to have that sense of independence and pride, is something that you really helped develop at Garton. And those stories were always so inspiring. So I think that will be the next topic of discussion. And I just appreciate your insights and your experience and your knowledge so much. Thank you. So we will be back soon. And check the resources in the comments section and Tim's contact information there as well. Bye for now.